most famous physical therapist on the internet.
Hi, folks. Brad Heineck, physical therapist, and
Hey, I'm Chris the Pharmacist.
today Bob is not here with us, but I'm sure you'll be very happy with the topic at hand and the information that Chris is going to help us with today. He's got knowledge on this that is excellent, and I cannot communicate it, or I don't have the brain power to figure it all out. So anyways, apple cider vinegar. Big topic for weight loss, cholesterol, and blood sugar management.
Yep.
Is it going to help with that? And that's what we're going to find out. Is it a viable product to use or not? And guess what? No giveaway today, so we're not going to go into that.
Sad. So sad.
But you can tomorrow, 9 p.m. to be Sunday night, 9 p.m. Yep, you can go to it. Let's go right to the topic. I just messed that completely up.
That
Anyways,
is okay.
Apple cider vinegar. We're talking about it. I always use the one with the mother. I've been using it actually for joint pain, which we're not covering. And we just did a video last night covering the use of apple cider vinegar for cramps, which had some really interesting and positive information in that regards. But we're going to talk about, let's get it right into weight loss.
Yeah, so kind of interesting stuff. So apple cider vinegar, like you say, whether it's, really pasteurized stuff, that's the nice clear bottle, or if you get organic and unpasteurized, or unfiltered, which has the mother, which I would tell you is probably going to be the better one to use, just because there's other little bits of nutrients and all good stuff in there with the mother. So I think it's probably more complete.
And that's kind of a yellowish orangish color, and it's got the sediment.
It's going to have some sediment. It's going to be a little cloudy. I mean, if you're going to mix it and put it, apple cider vinegar can be used in a variety of different ways. I mean, you can put it on your food, you can drink it. I mean, and what we're going to talk about with the dose for all of these is you're going to put a tablespoonful or 15 milliliters in 4 ounces of water. You're going to mix it and you're going to drink it. So that's one way of doing it. Or you can actually, there's a lot of other ways you can do it where you can just put it like on a salad or something to that effect. But we'll just talk about it. Straight up dose, 15 milliliters, tablespoon.
If you put more than 4 ounces of water, is it going to change anything?
No, as long as you drink it all, I think that's fine. So if you want it more dilute, for those who have never tried apple cider vinegar, it's got a very sour taste. So it may not present as it's for everybody, but for some people they like it. So and it just depends on your taste buds and what you like. But if we're going to use this for weight loss specifically, the dose range is either 15 milliliters up to 30 milliliters in 4 ounces of water, or even up to 8 ounces. When you consume this, and no matter what we do when we're talking about apple cider vinegar, after you consume it, I want you to make sure you rinse and gargle and swish water around on your teeth, because it can with plain water, because it can damage your tooth enamel if you don't protect it right away.
Because it's an
acidic product. It's about, on the pH scale, it's about 2 to 3. So it's a moderate acid. So it's something you want to be real careful.
So I just want to clarify again. He said 2 different volumes, either 1 tablespoon
or 2.
Not more than 2.
Not more than 2. 2 is an absolute max. And frankly, when you're looking at it from a weight loss standpoint, over 90 days, the research that I've found that actually has a little bit of, they had about 45, 50 subjects, which still very small, but I think it had enough evidence that shows, if you did the 15 milliliters in 4 ounces of water over 90 days, it caused a 2.7 pound weight loss, versus the 30 milliliters in the water over 90 days caused a 3.6 pound weight loss. So you're talking about just a couple of pounds. Well, what does that mean? Well, I think for a lot of people, when you have true fat loss, I think it's something that is going to be beneficial to you.
And I read something about this, the apple cider vinegar actually losing the stomach weight, that weight in the gut itself.
Yeah, they seem to say that it targets that. I've always been of the mindset that you could lose weight everywhere. So I don't know how true that is. And I haven't found straight up scientific evidence that says that, but there's a lot of anecdotal evidence that suggests that. So, it's not going to hurt you. The nice thing about apple cider vinegar is it's relatively safe stuff. If you're diabetic, specifically type 1, if you're on diuretics or on the special heart medication called digoxin or Lanoxin, you'd want to use care and caution with that. But we're going to touch into blood sugar lowering shortly too. But it's something that I think if you want to give it a try, I think it does have some application with some modest weight loss.
I do want to say one thing about it. After I get done eating a meal and I've got that urge for something sweet, that dessert, drink it then. it takes that urge for that sweet
Oh, yeah.
tooth right away from me.
It's
Like,
gone.
it makes you, ooh, and it's like, I don't even think about anything
and that's the one
sweet.
thing they actually say. The reason that they think that apple cider vinegar may be a weight loss, actually, you want to do at the time, it was actually better before you eat.
Okay.
Because it slows down gastric emptying. So that means what your stomach
yeah.
empties. And so if you feel more full, you're going to eat less. And so it kind of delays that. And the reason why it might help you with digestion and other things is that acidity might help to drive down, break up food a little bit better, and allow, because of that delayed gastric emptying, you got more gut transit time for that food to absorb. So your body is getting more nutrients out of the things that you're eating.
So take it before you eat.
Before you eat.
What if you took a little before and then afterwards to kill that sweet tooth?
I mean, if you want to kill it, I mean, I think, your remedy is certainly not going to hurt you, because I'll tell you that it doesn't taste great. So
it's strictly
I don't want to eat anything after it. So.
I mean, it does the trick for me. I don't want to have that ice cream. That's not in my mind after.
That's going to take away the craving for ice cream for sure. No two ways about it.
All right, you want to go on to cholesterol?
Yeah, why don't we? So, I mean, again, we're going to treat this, and much in the same way. Why it lowers cholesterol? We don't really have a definitive answer.
So we're talking about if we lower our cholesterol, it's going to help our circulation.
It might help with our circulation, might help with our heart functioning. I mean, minimize the risk for heart attack and stroke. So they've shown that, and again, smaller scale studies and more anecdotally, because we don't have the wide bodies of evidence that show it. But and I think a lot of it is because you can't really make a ton of profit off of apple cider vinegar because it already exists.
Right.
But that's the thing on big pharma. But if you're in a university setting and you got the gumption for it, guys, if you want to research on why precisely it lowers cholesterol, it would be interesting to know.
Sure.
But I can tell you personally, my cholesterol has been high for years. I got a familial deal on my side, my lineage. And so unfortunately, I've had higher cholesterol, and I started taking it I used it for 3 months before my appointment. And prior to the research I did on our last video that we did on this, I just wanted to see how it worked for myself. And I actually lowered my cholesterol 20 points.
And you were doing the same dosage?
I did 15 milliliters, 4 ounces of water every day, like right before dinner.
Sure.
So, and for whatever reason, my cholesterol for the first time in years was in a healthy range.
Oh.
So, I mean, it was, so again, you can't take that to the bank. If you're a physician or a cardiologist out there, you certainly may scoff at it a little bit, but I would tell you that there's enough anecdotal evidence that does suggest that it may be beneficial for you. It's not going to hurt you. So again, same warnings, if you've got gastroparesis, or if you're, using
gastroparesis
is when your stomach doesn't want to push food through there. So
is there another name for it? A layman's name that's slang?
Slow gastric emptying.
Okay.
Slows.
People usually know they have that. Yeah.
Your doctor's going to tell you it's more common with type 1 diabetics.
Okay.
Specifically, but it's something that we do want to be mindful of. So again, I'll always check with your doctor and your pharmacist, making sure they're looking at your profile, because if you're on diuretics, that could affect things too with electrolyte balance and how your potassium levels are, because that's important for your heart.
The water pills.
The water pills.
Yeah. Okay.
So want to be careful with that, but I do think that it does have a positive effect on cholesterol.
Sure.
And it can probably lead us into the weight or the blood sugar lowering too. So
let's segue right into that.
So with diabetes, there's two types. There's type 1 and type 2. Type 1 is the one that everybody has to have insulin. Type 1, this is probably not for you because there's a lot of you're insulin dependent, and the way that this lowers blood sugar could be dangerous for you, because if you get too low and you didn't make an insulin correction, you could have some serious problems. So this is something that, again, type 1, I would take off the table.
All right.
I mean, it's one thing if it's like in your salad dressing already, because there are types of things that we use kind of a vinegar based.
Yep.
So it doesn't necessarily have to be apple cider vinegar, but I think from that standpoint, it's just something to be aware of. Use in moderation, use accordingly. But if you're going to try and use it to help as an adjunct, it's considered mostly safe in most of the studies that we find. What they've done is an excellent example, and we've talked about this before. If you do 15 milliliters and 4 ounces of water, and you take it before a high carbohydrate meal. And the example they used was a bagel and orange juice. Okay. It diminished the blood sugar that went into the bloodstream tremendously. And so that effect when you're a type 2 diabetic is going to have a big effect for you, because that blood sugar control is everything from a diabetic standpoint. And so realistically, this is an adjunct that I think would be used with exercise and diet and obviously medication therapy that your doctor has provided for you.
Sure.
So talk with your doctor to see if it's appropriate. But I think it's a reasonable thing to bring up because there are clear studies, again, not large bodies of studies, but you're talking, a couple hundred people and multiple studies that have clearly shown whether it's, and the bagel and the orange juice is one. They've also done another one with white bread specifically.
Okay.
And they show a tremendous decrease, like 5% reduction in the amount of postprandial or after eating blood sugar levels. So it's got a benefit to it. And they actually did a study too, taking it at bedtime, which we'll talk about. One of the side effects is reflux and heartburn.
Oh, yeah.
But taking it before bed, if you do that, make sure you take it lots of water to make sure it's into your gut and moving before you lay down so we don't cause heartburn. But they showed that people lowered their blood sugar when they wake up in the morning by 4%. And 4% doesn't sound like a large number, but if you're teetering on the edge there's a big number they talk about, which is an A1C. If you're just on the border and you want to get down to a lower level, I mean, it's got its place.
Sure.
And it shows it pretty eloquently that it's got its place. But, there's a couple of downsides with apple cider vinegar we have to be careful with.
Okay.
So want to protect our teeth. So after you use this, you want to make sure you rinse and gargle really well because it can damage the enamel on your teeth. Some people actually find that it can cause heartburn. So we do want to be careful with that. So staying upright after you take it for 30 minutes would be ideal. So when I say the before bed dosing for the people that want to consider that, stay upright for 30 minutes and make sure you've consumed plenty of water on top of it to get it to absorb into your system as quickly as possible and not reflux back up. Yeah. Because heartburn can be damaging and can be really problematic. Yeah, so we have to use a modicum of care when we're going to use this. And again, you do want to protect, yourself, and you want to talk to your doctor and talk to your pharmacist to make sure it's appropriate for you.
Sure. Is that it?
That's pretty much it.
Well, I did want to mention a couple of things.
Okay.
Just from, this is anecdotal, but people that comment on our other apple cider vinegar, there was a number of them that actually said it got rid of their heartburn, which I don't know how that works.
And that's actually, and I looked at that a little bit too, and it seems like it's almost more homeopathic at that point. You're taking acid to treat acid. Okay. And so there are burgeoning amounts, there's large amounts of anecdotal evidence, not a lot of large-scale studies that do suggest that it may be beneficial. So in certain populations, I think it's something that you can consider, but consider with caution. Yeah, just like anything else. I mean, if it helps you, we've solved a problem, and I think that's wonderful. But again, it's not for everybody. Some people aren't going to like the taste. Yep. But I mean, at some point, I think it does have some possible, benefits that I think are really worth exploring.
For me personally, joint pain in my hands.
You've said that for years.
Yeah. About 3 or 4 years ago, I couldn't even close my fist, and it came on really suddenly. I was really concerned, and I'd wake up in the morning, I could never make a full fist, which was really weird because I'm an active person. I was concerned about how I was going to function. That's right. And so I started taking this from a friend of mine who, it's a long story, but anyways, within 2 weeks, I noticed things getting better. And so I took it for about a month or two, maybe close to 2 months, and it got about 80% better, and I just quit taking it because it doesn't taste that well, and I felt pretty functional. But recently, because we talked about this again, I started taking it again because this finger right here is particularly sore from an accident, I believe. Anyways, it seems to be improving it again, so I think it's got some pretty good
anti-inflammatory benefits.
Yeah, it's working for me personally. I can't vouch it, or I'm not going to give it a blessing for everyone, but
I mean, again, just don't be afraid to speak up to your doctor and speak up to your pharmacist. Let's make sure it's safe. But I think it's got an application. Yeah. And
if you're a healthy person, you're not taking any medications, and you just take the doses that we're talking about.
I think it's reasonable. I think it's reasonable to try. And if you want to give it a try, I think we'll see some positive results. And we'd like to see your comments to see how it does for you too. Yeah, it's always interesting to get that kind of feedback.
Yeah, a little feedback, little input. All right, Chris. Well, once again, we've tackled another world problem, and we're going to go on to another one.
Excellent.
And just right after this, we're going to talk about
neuropathy.
All right. Very good. Have a good day, and be careful.
Thanks, guys.